Remember me talking to you guys yesterday in lecture about all of the different projections that we can actually do with this particular machine. So P1, that is the standard Pano that we actually use today. You can do a left or a right side. This is one that's artifact free. This is the one that we would do for pedo, so that's the P10. Then we also have a P1C. It's a standard Pano with constant magnification, also ideal for larger patients. So again, if you did one using the larger patient setting in there and that didn't work, then, or maybe it was too late, you could retake it again using this setting. The P12 is to obtain a thick layer of the anterior region. So maybe there was something going on there you wanted to see. You could use that as a setting. Then of course you have the bite wing. Remember me talking about that? So the BW1 is the posterior, right and left. The BW2 is just the anterior and it goes all the way back to premolars. Then we have the TMJ, so you can actually see like the coronoid process there. And then we also have, this was the one I forgot to tell you guys about, we actually can see a picture of the sinuses. So remember when we were talking about if somebody had like a sinus infection, they're having pain in their teeth, nothing's wrong with their teeth, then at that point we could do one of these sinus things to check and see, okay, is there something going on in their sinus cavity? And then MS1 is a multi-slice posterior teeth. So this would be useful or helpful for localization, okay? So if you were doing localization, trying to determine if it's located buccal or lingual, that might be helpful or useful for that, okay? So any questions about this part with the, okay. So then the last thing I'll show you, so this is my Pano. So I wanted to show you guys my mesiodens, and then I wanted to talk a little bit about anatomy. So again, that's something that would be abnormal, out of the ordinary, not normal anatomy, right? You notice the mandibular canal here that you see, of course, the border of the mandible. Look at the mental foramen where they're located at. That one is located directly below the apex of the root of tooth, the second premolar, but tooth number 20 on the left side. So again, this is a good review to go over for when we do anesthesia. So if you had seen this radiographs and you were going to be doing anesthesia on me, you would know that instead of doing the normal injection where we basically take the cartridge down here between the two teeth, it would be better to do it closer to that second premolar if you know that that's where the mental foramen is. Does anybody remember what portion of the nerve, what the name of the nerve is that comes out of the mental foramen? It's a smaller branch of the...
Bio?
What is the IA? What is it?
Oh,
what does that mean?
Oh, inferior.
The inferior alveolar. The inferior. So the inferior alveolar comes down here. It goes into the mandibular canal, and then there's a portion of it that comes out of the mental foramen. If we were doing the maxillary, the 3 injections maxillary. So you have your PSA, your MSA, your ASA. Your ASA is going to be doing just the anterior teeth. It goes between your premolar and your lateral. Your PSA close to the second premolar, sorry. And then your PSA, I said MSA, PSA is going to be behind your second molar, okay? So when you're giving these injections, depending on where it is that you're working at, you would also potentially need to give palatal injections. For you guys, you'd probably never need to give palatal injections just for scaling and root planing. What you would have to do is you would have to give injections if, like, say, the dentist was doing like major restorative, like extractions or crowns or something like that. So does anybody remember what this foramen is called?
Incisive. The
incisive foramen. So remember, if you give an injection here, that's going to numb up just the lingual tissue from K9 to K9. So basically this area right here. What is this foramen called?
Greater.
The greater palatine. So that's going to numb up basically all of these teeth, premolar and molar. So if you were doing, like say, quadrant scaling and root planing, you give 3 injections on the buccal, and then you basically use gingivecane subgingivally here. That should be enough to anesthetize the patient. If the doctor was doing an extraction, they would have to give 3, well, I guess maybe they're extracting all the teeth, let's just say. The patient's teeth are in terrible perio shape and they're extracting all the teeth and they're going to do implants. Okay, so then they would have to give the 3 on the buccal and then the 2 on the lingual to anesthetize all of the tissue before they can go ahead and do the extraction. So any questions with that at all?